Hi, I'm Amy Pruitt. I'm the manager of tissue services here at the Indiana Donor Network, and I'm here to talk to you a little bit about tissue donation. We're going to start with the basics on tissue donation as well as recovery. Oftentimes people haven't even heard of tissue donation, so the first thing I'd like to cover is really what is tissue donation. The process of recovering tissues, which are cornea, skin, bones, etc., from a deceased donor or decedent for use as transplant in procedures to repair various defects or injuries in a living recipient, is essentially what is encompassed by tissue donation. What it is used for is often said to enhance life for recipients. Heart valves actually are life-saving donations. And anyone who has really ever experienced a loss of their quality of life will tell you that quality of life is life. So to restore that is really a life-saving process. Tissue recovery, our time of death, our clock starts ticking. So if a donor is not cooled or refrigerated immediately after death, skin prep must occur within 15 hours for us to actually be able to recover tissues. If that donor is cooled and refrigerated after death, however, we will have up to 24 hours to perform that skin prep and recover tissues. Different tissues for different processors actually can change on that depending on what processors prefer. However, it tends to fall within that 24-hour range if they're cooled. If they're removed from cooling at any point in time for transportation purposes, we actually have to add up the times in which that donor is not cooled. And if that exceeds 15 hours, we would not be able to perform recovery. At the Indiana Donor Network, we perform approximately 95% of our tissue donor recoveries in-house, and only about 5% are out-of-house. Those are due to family wishes or coroner restrictions, anything like that that might keep us at a hospital or a coroner's office. Here are some frequently asked questions that we get about tissue donation and recovery. Who can donate tissue and what are the restrictions? Really, almost any person can be a tissue donor. It's much easier to be a tissue donor than an organ donor. Anyone who's interested, we usually just say, don't rule yourself out for any reason, whether it's age or conditions. It's determined at the time of death what tissues can be donated. So even if a majority of tissues can't be donated for one reason or another, you still might be eligible for another type of tissue. Does tissue donation delay or impact the funeral process? Since cornea and tissue donations take place within 24 hours after time of death, donations have to be completed as soon as possible. So there really is a minimal delay or impact in the funeral process. Usually what holds up that process is going to be us following up with the family and trying to get the paperwork completed. So usually if your family knows what you wanted at the time of death, it's going to move a lot faster for the entire process. There is no guarantee that the recovery of certain organs and tissues won't change the appearance of the donor. It might create a specific need for certain clothing choices for an open casket, but it doesn't change anything as far as usually timing and open caskets are concerned. Where and to whom does donated tissue go? For the Indiana Donor Network, at least, tissue that's recovered here, it's distributed in the following order based on need. We always attempt to have our tissue distributed locally first. If it is not needed locally, we'll go statewide, then the Midwest region, then nationally. Then and only then would we look to see if that tissue is needed overseas. Approximately 2.5 million tissue transplants are performed every single year, so anyone who needs it is where this donated tissue will go. Things like blood typing are not as important in tissue donation. As much as grafts have been decellularized during the process, which means they've had DNA is removed from the donor tissue, we don't have to worry as much as organ does about things like ABO blood typing or anything that might have been going on as far as the donor's tissues. How much tissue is taken during recovery and from where? How much tissue is recovered and where it's taken, it really is dependent on a variety of factors. We're looking at age, health, cause of death, tattoos and their placement, the condition of the donor's body. The maximum of tissue donated could look like skin taken from the back, abdomen, anterior thighs, saphenous and femoral veins along with the femoral arteries, lower musculoskeletal tissue, including the hemipelvis, and that's from each leg, as well as the whole heart for valves and the corneas. On the flip side of that, the minimum might look simply like one of those. So just corneas being donated. It doesn't change the fact that each gift is just as important as the next. Is a donor able to choose what tissues they want to donate? Normally, when registering online, some states are going to give you the option to decide what tissues you would like to donate, as well as which organs you'd like to donate, or if you want to donate everything that can be used. Alternately, most advanced directives will have a certain section about organ and tissue donation that will allow you to express what you want after you've been deceased. The issue with that is normally for tissue donation, it's not an anticipated death. So if your family doesn't know what you want, it can be difficult for people to find those documents within enough time for us to make that determination of your donation. You can also choose to donate for transplant for research or for educational purposes. And additionally, you can choose to donate only for transplant and limit other types of donation. How long can and will tissue be used? The tissue will be used by processors until all of it has been transplanted or until it expires. While processing varies between different processors as well as tissues, the basic steps consist of cleaning, cutting, washing, soaking in disinfectant solutions and or antibiotics, shaping, sizing, culturing, and packaging. Some tissues are additionally irradiated depending on their use. Now, often, fresh grafts receive no processing, and so they're tested, matched, and transplanted as soon as possible. Also, depending on the graft, expiration can run anywhere between 14 days, which would be corneas, to 10 years, which would be heart valves, with an average of about 5 years for cryopreserved tissue grafts in between. Essentially, it just depends on what temperature they're being stored at and how they're being stored, as far as what water concentration is remaining within the tissue. How long will tissue grafts last in a person? So a recipient. In a person after transplant, the life of an allograft depends on the tissue as well as the age, health, and activity of the recipient. So donor heart valves can last 10 to 20 years depending on the recipient. They usually don't require the use of long-term medication, which is always great news for those recipients. Most bone and skin grafts will heal in about 4 to 6 months, and they'll last a lifetime so long as no rejection takes place. Saphenous vein grafts can last anywhere from 1 to 10 years, and ACL grafts can last up to 20 years. What tissue can be donated? Corneas, veins and arteries, skin, heart for valves, bones and tendons. There are other tissues that can be donated. However, at the Indiana Donor Network, these are the major tissues that we actually recover. So then we're going to talk about graft types and their purposes. So what can cornea grafts do? They restore vision, they can reduce pain and improve appearance of a damaged or diseased cornea in a recipient. Cornea transplants restore sight to those who suffer vision loss, mainly due to corneal blindness. And corneal blindness can be caused by a variation of things. Trauma, infection of the cornea, keratoconus, which is the cornea is cone-shaped, Fuchs dystrophy, pseudophakic bullous keratinopathy, corneal degeneration, and also corneal transplantation can also be due to corneal injuries or infections. Cornea grafts do not actually change the recipient's eye color. Some people don't realize that the cornea is a clear membrane that goes across the front of the eye. The iris is what's responsible for eye color. So having a cornea transplant will not change the color of someone's eye. Corneas do have to be transplanted within 14 days or 2 weeks of recovery. More often than not, they're actually transplanted within 1 week, so that doesn't tend to be an issue. And most cornea transplants have a 95% success rate. Vascular tissues. What can vascular tissues do? So many veins and arteries actually overlap on their various functions. For coronary bypasses, the saphenous vein is frequently used. Bypasses below the knee is saphenous veins and femoral arteries. Patients with infected fields, which we would definitely use saphenous veins and femoral arteries for. Patients with a high risk of infections, they often use saphenous femoral veins and femoral arteries. Functional hemodialysis access has been recently a big topic for vascular allografts. They can use saphenous veins, femoral veins, and femoral arteries. essentially to be used as an access point for hemodialysis instead of artificial fistulas, to give those a chance to actually heal when performing chronic use of dialysis on diabetic patients, which is fantastic for them. Patients with a synthetic graft infection, they can use femoral veins, aortoiliac arteries. Femoral veins for patients in whom a fistula is not possible. Mycotic aneurysms, they use aortoiliac arteries. In trauma and also aortoenteric fistulas, they also use aortoiliac arteries for. This is just an example of some of the different vascular grafts and what they look like. So you can see the LeMay saphenous vein graft, a LifeNet Health femoral artery graft, a LeMay femoral vein graft, and an aortoiliac artery graft from LifeNet. And if you're looking at these tiny veins and what they actually look like, you'll see tiny black incisions is what they appear to be. What they are is our processors have to go through these veins with surgical loops, and they actually make little sutures along the tributaries that they have to sew up. So it becomes one continuous hollow vein graft that they can then use to place inside of the recipient. Skin recovery. So skin is recovered from the following zones. Posterior, we recover the thoracic area of the back and the posterior legs, so the back of the thighs and the back of the calves. Anterior, we recover on the abdomen, the stomach, and the legs, both the thighs and the calves. Not all zones are always recovered. It really depends on the processor. It depends on the family, if there's trauma, abrasions, or bruising, tattoos in their placement, organ donation, and other tissues that might have been recovered. What can skin grafts do? Donated skin is critically needed for patients suffering from burns or trauma. They're used as a bandage, essentially, to protect the body from infection and promote healing. Donated skin is often used for cleft palate repair and other facial deformities. Mastectomy reconstruction often requires the use of allograft skin. And current research shows that allograft skin grafts may prove to be successful in incontinence surgery as well. Some of the pictures that we have, you can see that one of the things people don't think about as far as skin grafts go is it's not just about coverage and the look and the aesthetic, but it's also about the range of motion that a skin graft can give back to a burn victim. When you get rid of some of that scarred tissue, you actually regain some of that motion that you lost when your skin actually kind of constricts and contracts when it's been burned. So it's really important for people to kind of get back to their normal life. What can cardiac tissue grafts do? Donated heart valves replace damaged ones. That allows the heart to function normally again. So when they're used in young patients, donor heart valves will actually grow with the recipient, which reduces the need for repeated surgeries down the line. Donated pericardium, which is a membrane sac that encloses the heart, it can also be used as an alternative to using dura mater as a covering for neurosurgery. So they can actually use the sac that encloses the heart as a replacement for brain covering when they do neurosurgeries, which is really fantastic. Here are some examples of cardiac grafts. We have the CryoLife pericardium, that's that membrane graft, the CryoLife pulmonary heart valve, and the CryoLife aortic heart valve. Again, these as tissue grafts, they are not given based on ABO, but with cardiac grafts, they are given based on sizes. So someone might have to be on the list for some time as they wait for the properly sized heart valve to come in for them. Bone and tendon grafts. The patellar tendon can replace the ACL and PCL tendons. The tibialis tendon is often used in ACL reconstruction. The Achilles tendon can replace the PCL and be used as a rotator cuff. And it can also replace the Achilles tendon where the hamstring is used in the ACL repair. The femur and tibia, they can be used whole. They can also be used in reconstruction related to trauma, tumors, degenerative disease, fractures, and cartilage recoveries. They're also often made into dowels or cortical spacers to be used in spinal fusions. Femurs can be broken down into cancellous and demineralized bone powders, which often is used to fill defects and augment prosthetic device implants. The tibia can also augment large grafts and prosthetic implants as a cortical strut or to be used in joint surgery as a meniscus. The fibula is often used during the repair of traumatic bone loss, and the ilia can be made into an iliac crest wedge or ilium strip to be used during spinal fusions or broken down into cortical cancellous bone for filling defects and augmenting prosthetic device implants. Here are some beautiful examples of bone and tendon grafts. Cancellous bone in all of its various forms. Cancellous bone is the spongy type of bone with more airspace between the cells. And that's going to be found kind of inside of the larger bones. They can turn it into a paste, they can turn it into powders, they can turn it into chips. They can essentially turn it into whatever they need it to be to fit into the space they're trying to fill. Tendon grafts like the Achilles tendon with bone block, the peroneus longus, the gracilis, and the semi-T, those are often used to replace damaged tendons in athletes. And cortical bone in its various forms is going to be that stronger outside part of the bone, the femur, the tibia, the fibula. Those are often used either whole in cortical struts, or they can be turned into discs and used in spinal fusion, different spinal fusion surgeries. There's also specialty bone and tendon grafts. The Joint Restoration Foundation, or JRF, they're the largest fresh graft organization in the world, and their grafts actually have a 28-day cycle that they have to be used within. So being fresh, they're not processed at all. Once they're taken from the donor, they have 28 days to be tested, matched with a donor, and placed. So these fresh osteochondral allografts, they have a mature hyaline cartilage inside. And essentially, the higher the viable chondrocyte number, the better they are for the donor. Blood type does not matter. So again, cartilage is avascular. It has no immune response, so they can use it for anyone as long as the size matches for that donor. The bone used in these transplants is minimal, and it typically contains no marrow. It's more about the cartilage. These are really important to most donors because they usually come from younger donors, and they usually go to younger donors who are more athletic and need a graft that's going to continue to grow with them, and it would last longer for them than a prosthetic would. So here is a long list of JRF grafts, and the biggest thing you'll see in common with these grafts is that they contain different osteochondral plates, and that is the areas of cartilage that's going to cover the bone. So different areas where we have the whole tibial plateau versus a single tibial plateau, a whole femoral condyle, a talus, a patella bone, a meniscus with bone block, femoral trochlea, femoral head, distal tibia, or pre-cut fresh OCA cores. Now those cores can actually be used, they will cut open just a circular area that needs replaced only, and they'll replace that with just a pre-cut fresh core from healthy bone donor tissue. The impact of tissue donation. So here I wanted to share some stories from both the recipient side as well as the donor family side of tissue donation. We often hear about these things from organ, but we don't hear so much from tissue. So I think it's important to share that tissue families are just as touched by the donations that they receive. So we heard from a mother of a 15-year-old donor. She said, "Hello, I am the mother of the 15-year-old who received your loved one's tissue, femoral cartilage. My son had a chipped bone and almost no cartilage in his right knee, and after finding it at a late age, this was a necessary thing. My son is a freshman in high school and currently in the swing band and plans to continue once healed. He does procession this year, he did cymbals, and will be trying out for bass drum next season. I'm sorry for your loss and pray this brings you comfort. Sincerely, Denise." So this was actually a JRF graft that her son received, which means that the donor would have been fairly young, probably between the ages of 13 and 35. I'm sure it does bring this family comfort to just hear a sincere thank you from someone who you don't normally think about as far as tissue donation, who this touches, but I mean, a 15-year-old received this person's tissue, so that's very meaningful. Dear donor family, I'm writing to thank you for the kind and generous gift of tissue donation from your loved one. I'm sorry for your loss, but I want you to know that your decision to donate has changed my life in a very positive way. I needed a tissue transplant because I got a major surgery to correct my scoliosis. The tissue was used to repair my bones and keep them strong. Since the transplant, I have been able to breathe again, as the repair was done while straightening my bones, unpinching them from my lungs. For this, I am very grateful to you and your loved one. My family and I will always remember your act of kindness and generosity. And this is from a 16-year-old named Jordan. So again, this is a thank you letter to a donor family from a child who is essentially saying, you've not only enhanced my life for the better, but I'm sure as far as this person is concerned, that's life-saving, that they're able to breathe normally, which is something that they really weren't able to do for the majority of their life. So it's really a beautiful thing to say thank you to someone who's given you that. Now here is a kind of story from a tissue donor family. Earlier today, my sister Rebecca shared a letter dated September 11th, 2020. In the letter, Stephanie shared that mom's skin was donated to 5 post-mastectomy patients. This is incredibly meaningful to us. I was diagnosed with breast cancer at the age of 34 and again at the age of 40. My mom was tremendous support to me through chemo, 10 surgeries, radiation, and much medical care. At one point in treatment, when I was very sick and in a lot of pain, she said, "I wish I could do this for you, honey." I shot straight up out of my fog and said, "No way, Mom, I would never let you do this." She would have traded places with me in a heartbeat. That was our mom. She was a caretaker through and through. She not only took care of me through my darkest times, but so many of our family and friends. She was a primary caregiver for her own mother, her friend, and her sister until each of their deaths. She was my father's primary caregiver until the day she died. He is now 95, and not a day goes by that he doesn't mention what a great woman she was. My mom would have been thrilled that she could help not 1, but 5 women who went through something similar to me. She was happiest when she could give of herself and help others. So not only is tissue donation something that kind of transcends and helps the person who is the recipient of that donation, obviously, but it really is a healing experience for the tissue donor family as well. They're able to feel that family member living on. They're able to watch their legacy continue to grow. And with tissue donation, it can actually last as long as that tissue lasts, because they're going to be receiving updates on that tissue for as long as that tissue lives on. So that tissue could be in a storage facility for, as we spoke, up to 5 to 10 years. So again, they're constantly receiving updates up through that 5 to 10 years. A son and brother of a tissue donor shared this photo with his mother, and he had said, "I took my district manager of the quarter certificate out of its frame and used it for the Indiana Donor Network certificate you sent me. That is something to be much more proud of, knowing my little brother left this earth and not only made an impact in the lives of those that loved him, but those who never knew him. It's priceless." The donor's mother said that the care and compassion her family has received has made the grieving transitional time less painful. And that's essentially what we do set out to do. But more importantly, again, tissue donation, it's not just about the donor, it's not just about the recipient, but it's about those who are left behind as well. So the donor family is able to kind of grieve and move on, move forward, as they hold on to the positive impact that their loved one made. So there we go. I want to thank you very much for your time.